Well, hello and welcome to today's webinar, The Impact of TEFCA on Secure Exchange of EPHI. I'm Carol Flagg of Answers Media Network and Healthcare Now Radio, and I want to thank you for joining us today as we continue our series of educational events with eFax Corporate. Today's event wouldn't be possible without eFax Corporate, of course, a brand of J2 Global Services. J2 is a leading provider of Internet services through its two divisions, Business Cloud Services and Digital Media. For more information, visit enterprise.efax.com. We have two presenters today discussing our topic. The first is Lee Barrett, the Executive Director of the Electronic Healthcare Network Accreditation Commission, or EHNAC. Lee speaks nationally on security, privacy, ransomware, and cybersecurity risk management and assessment, and mitigation strategies, tactics, and best practices. He has been appointed by the ONC to the Executive Steering Committee for the ONC's Payer Plus Provider Fire Task Force. He is a member of the HHS Cybersecurity Task Force, as well as the chair of the National Trust Network Data Sharing and Cybersecurity Task Group. He also currently serves on the EHI Leadership Council and Direct Trust Board. Presenting alongside today is Jeffrey Sullivan, the Chief Technology Officer for eFax Corporate. Jeff has over 25 years of experience growing small to mid-sized companies to fuel success with the innovative use of technology. His past 15-plus years have been spent as C-level executive, and he is a passionate advocate of the use of technology to enable and drive growth, not as a cost center. He has continuously demonstrated the value of agility in today's high-growth companies, where the ability to deliver value incrementally and to change priorities often is a major competitive edge. On today's webinar, Lee and Jeff will be discussing key federal programs and industry partnerships that offer resources to improve data security and privacy, how TEFCA improves organizational security. They'll examine some best practices for identity verification, authentication, and privacy and security, the impact of blockchain, cloud-based data storage, and other enabled technologies, how TEFCA can lead to better care and lower costs for both healthcare providers and consumers, and finally, we'll leave a little time at the end for some Q&A. And now I'll turn today's presentation over to Lee and Jeff.
So Carol, thanks very much for the introduction. And what we're going to do now is, as Carol indicated, Jeff and I are going to kind of take you through a whole process here, looking at not only TEFCA, but blockchain, a lot of different technologies and issues that we think you're going to be very interested in as we go through this. And hopefully, as we do so, it's going to generate some questions that you're going to have so that we can answer those at the end of the presentation. So let's go into TEFCA, and let me give you a perspective on what this is, what it hopefully is not as well, and what we're trying to do, what the industry is trying to do, in the Office of National Coordinator in particular. If you look at this, you know, this really started with the 21st Century Cures Act of 2016, which was really a joint collaboration between the Office of the National Coordinator and really Congress. And the focus of it was really to develop a trusted exchange framework and really a digital highway for data exchange, electronic healthcare data exchange, and to create the on and off ramps for organizations to be able to perform that type of data exchange. One of the biggest things that's been a real issue, however, is around all the various agreements that all organizations need to have between each other in an effort to exchange data. So a big component of this is to develop a common agreement amongst all of the various health exchange or stakeholders in an effort to accommodate it, reduce the number of different agreements that are going to be necessary, and create a more streamlined way in which organizations can be able to exchange data on and off, on these on and off ramps. So that's really the precept that 21st Century Cures did, and this is the first version. So really it was all about kind of the policy, the procedure, and kind of setting up the infrastructure to do that, not the actual implementation. We're going to talk later about some of the existing work and conversations that are going on about the potential for a Cures 2.0 version, which is really going to get more into the implementation. So now we talk about TEFCA. So TEFCA in 2019 really becomes one of the, quote, kind of implementation side and setting really the premise for how this digital highway gets established. And it puts in place not only the on-ramp, but determines really who the stakeholders are, which are really going to be qualified health information networks or health information networks, a number of acronyms you're going to hear here, and create kind of the scalability that's going to be necessary in an effort to ramp up all these organizations to be able to do this data exchange, as well as providing really kind of the organization that's really going to provide the oversight. So go to this next slide and talk about how it's going to work. In this slide, you can see that there's the RC, or the Recognized Coordinating Entity, really at the top, that's really going to have responsibility for development, oversight of the qualified health information networks. They're also going to have responsibility for developing the common agreement, and they're going to be working with the industry to draft that, again, all under the Office of National Coordinator, ONC's guidance. And then you have the QHINs, and there's going to be multiple QHINs that will be part of the data exchange, and that the participants themselves here who will be really querying and asking information and trying to get information, which could be a hospital, could be a patient, could be any of those people that are actually looking for information that are going to query the various QHINs to get that information and to populate it. So that's how this looks to evolve going forward. You look at the timeline. This really actually started, and again, you had seen before this, there was a couple of versions of TEFCA that came out. The first one came out in January 2018. Another one came out in April of 2019, asking for comments and feedback. That feedback has now taken place, and as well in the April TEFCA version, they also set out kind of a roadmap of time. And so one of the key precepts was to make a determination and announce the recognized coordinating entity, which they did in September. And that recognized coordinating entity is the Sequoia project. So if you look at the timeline here, there's several things. There's the Trust Exchange Framework and the Minimum Required Terms and Conditions, which is MRTC. So these drafts came out, as I indicated. There was one in January 2018, one in April, and there was a public comment process that took place in June. And then the RCE itself was awarded, as I talked about, in September. And so now in 2020, the plan forward is for the RCE under ONC direction to move forward to start drafting the common agreement with the industry. And this is going to take place through a very open, transparent process that the RCE has already talked about, which is really to have webinars, public forums, and other venues in an effort to gain feedback from the industry with an intent to get a common agreement with the industry by sometime later in 2020. So that's kind of the time frame and the timeline that the industry is going through. If you look at all of this as it's playing out in the industry, there's also an initiative called the Trusted Network Accreditation Program, which is a collaboration with a number of healthcare organizations, both providers, payers, other stakeholders, that have worked together over the past year in an effort to develop an accreditation program that will look at both privacy and security, and it will also take into account other aspects of TEFCA and 21st Century Cures, again, it's aligning with those, not dependent upon, but we'll take into account things like emerging technologies such as blockchain and other aspects that are going to be incorporated in it. So this initiative started in July of 2018. It's gone through a very significant amount of review and development, went out for a public comment period over the summer of 2019. There were 6 different beta organizations that took this and went through it. And so all that feedback has been incorporated into a final version that went out in October of 2019, just about a month ago. I think one of the questions that is often asked by people is, well, you know, TEFCA and other aspects are continuing to evolve. Will this also be this accreditation program be able to evolve with that? And the answer is yes. So as new revisions, as new enhancements happen, this program will continue to be enhanced by that collaboration, and we intend for it to be very publicly available. And so organizations can actually download this accreditation program now for free to see what it's like, what they need to do. And so as QHINs in this entire process continues to evolve and roll out over 2020 and beyond, people can look to see exactly what's incorporated. So that kind of gives you an overview of what TEFCA is. We're thinking clearly from an interoperability perspective, from a privacy and security perspective. The whole aspect of stakeholder trust is going to be critical here for patients and other entities that are going to be leveraging this infrastructure. So, Jeff, one of the things I wanted to ask you about is that, you know, as I've kind of gone through this, what do you think about the HIEs? You know, how are they going to fit into, how do you think they're going to fit into this TEFCA 21st Century Cures picture going forward? Any thoughts there?
Well, yeah, you know, I do think that, look, you know, the philosophy that's embodied in TEFCA is just a vision that I think everybody endorses and can get behind. I think what's challenging for all of the HIEs is how do they leverage the investments that they've done in their local or regional areas for exchange into this national on-ramp. But, you know, I see the you know, dozens and dozens, hundreds of exchanges and participants, you know, wanting to be part of this network, you know, joining in and participating through a QHIN and being part of this network of networks. And, you know, clearly where we've come from, you know, these regional exchanges to getting that one national exchange is goalpost, is the vision, and I think it's a vision that everybody can get behind. The devil is always going to be in the details, and I think, Lee, the question here is how does something like, you know, these partial solutions, you know, Commonwealth or Care Quality, how do they get into that one nationwide frictionless on-ramp to this interchange?
So I think that it's a great question. And I do think that both Commonwealth, Sequoia, and a number of other organizations are at this point, certainly Sequoia as being the RCE is looking to pull together all the appropriate organizations to determine not only obviously the common agreement, but how this infrastructure is going to work and how organizations, the QHINs as well, get engaged. Commonwealth, as you indicated, Jeff, is going to play a significant role as well. We're going to have to determine how some of these organizations do incorporate and get engaged. But I think every one of these organizations are going to have components that are going to be leveraged as part of this. And so it's really going to be a matter, this is somewhat early, although I think that the Sequoia as the RCE is looking to really coalesce all of the various organizations, and I think as well they're going to be very open and transparent about it. So it's going to, I think it's going to remain to be seen how this, you know, they engage all the organizations, although I think they're absolutely trying to be very transparent about it. So I really do think as well, this is going very quickly. I do think that they have a 1-year, Sequoia's got a 1-year contract with ONC. So I really believe they're in the process of putting together their own roadmap, this agenda very quickly. I do think as well, I think the fact that there's the QHIN technical framework that is part of this that got rolled out, which kind of provides the technical and functional requirements, is really going to help organizations here as well. And I think the fact that they elongated some of the timeline for the common agreement and for organizations to align and to get on board,
right,
to sign the kind of agreement went from 12 months to 18 months, I think is also going to help to get organizations onboarded here. So I think there's a variety of things that ONC listened to from the feedback, and so that's kind of my thought on how some of this is going to be playing out. So as we've talked about TEFCA, we're now going to evolve into, hey, what are some of the other federal programs and industry partnerships that are going on in the industry? Obviously, we've talked about the 21st Century Cures, but I did mention previously about the Cures. We have Cures version 1.0, but we've got another Cures 2.0 that's currently being discussed on the Hill in the legislative and congressional chambers. What I think you may remember what I talked about as far as the first version really kind of set out the overall policies and the process for how the digital highway is actually going to be implemented. Now, what it didn't get into, and so what 2.0 and some of the discussion that's going on congressionally and with ONC is the actual how. And so some of that dialogue is going on. I think they're also waiting to see how TEFCA continues to evolve. And they're also looking to see how the industry, I believe, is looking to adopt and to move forward and to really coalesce around this vision. So I think depending upon how a lot of that evolves is going to determine what they're going to put into Cures 2.0 from an implementation perspective. But I think the thinking is around providing more detail on the how organizations need to do some of this. As we look at some of this as well, and we look at some of the initiatives, again, not only around TEFCA, but 21st Century Cures, is the whole entity that's been focused on by the Office of the National Coordinator around FHIR implementation as an application program interface, API. FHIR is really, from an interoperable perspective, and was developed by Health Level 7, is really being viewed as a key linchpin to really assist the industry with moving forward aggressively, especially between interfaces, applications, that FHIR itself can help to break down some of the interface barriers that have been there between medical devices, different systems, and the whole exchange side of this, so that FHIR becomes kind of the glue and a standard that's such that organizations can use these APIs to now not have what I would call proprietary interfaces, but they can do it using a standard like FHIR. So ONC has had this initiative in place and is focusing, and there are a number of what are called Tiger teams that are addressing the implementation of FHIR. And there's a couple of initiatives that you might want to be aware of. One is called the Da Vinci, and the other is Argonaut. Both of these have really been initiated with Health Level 7 as the standards organization in an effort to develop use cases on how fire can actually be implemented and utilized. So Da Vinci specifically has been focusing over the past couple of years on health plan specific use cases versus Argonaut has been more holistic, looking at a variety of other use cases in the healthcare industry. Both have been leveraged, both of these initiatives have been leveraged by the ONC Fire Tiger teams in an effort to develop and to review issues such as security. How do we secure all these APIs? The whole aspect around testing and certification. Architecture, how do we look to design these various use cases to take advantage of fire? So these Tiger teams have been working to do that. So again, it's really an industry partnership where not only ONC, but all the Tiger teams have been working with Da Vinci, Argonaut, and the public sector in an effort to continue to move forward and to develop different recommendations, again, aligning with TEFCA and 21st Century Cures. From a cybersecurity perspective, as all of you are aware, within healthcare, it is a very significant issue. And you look at cybersecurity and cyber attacks, ransomware attacks are actually continuing to increase. And they're very large in many cases in relation to their impact, as any one of these ransomware attacks can take over entire hospital environments. And you're probably reading about them as well as I in the fact that many hospitals are rendered completely their EHR systems are completely taken over. They can't even use them. And in fact, many have been paying the ransom in an effort to get them back. Others, because they don't have an infrastructure in place as far as backups, etc., have been going through really a process of trying to get up to speed and ensuring that their risk analysis and their policies, procedures, best practices that they're implementing are brought up to current levels of cybersecurity. So there's an initiative by Health and Human Services that's been put in place called the 405D, and this particular initiative has really been working with providers in particular and came out with a whole set of industry best practices to help the provider community, everything from solo practices all the way up to major hospital systems, to be able to implement risk assessments, other types of best practices around things like phishing and having to do with email, how they're doing their gap analysis, how they're addressing other aspects and what I would call risk vectors. So that initiative is going on, and there's a lot of alignment as well that's happening with there's another organization called the Healthcare Sector Coordinating Council. And so that initiative is both a private and public sector initiative to align all the various cybersecurity initiatives that are going on and to minimize redundancy. So, and then we've got some other legislation that's happening. CMS, for example, has submitted to the Office of Management and Budget interoperability and information blocking rules. So those are also going forward. Those have been significant issues in the industry. And then the Health Information Alliance Initiative is looking at some additional enhancements to HIPAA. So as HIPAA has become kind of the key entity around privacy and security for data exchange, we're continuing to see other aspects here with the Health Information Alliance to look at how we can look to further enhance HIPAA as really kind of a precept and an oversight on how data exchange is handled from a privacy and security perspective. So as we kind of look at all this, Jeff, I wanted to turn to you for a second. And, you know, as far as some of these initiatives that you're seeing that I've kind of gone over, any other kind of initiatives, partnerships, or federal programs that you would that you would highlight as well that people should be aware of as far as on this webinar?
Well, I think the ones that really jump out at me, security being such an important thing here, getting that security awareness up and out into the community, as you say, with the prevalence of incursions and exfiltrations of data, ransomware attacks, everybody needs to understand how top of mind security is for everyone. And so the work that the 405B group has been doing in the HSCC has been crucial. And I think the thing that security researchers and security specialists really understand is that education is such a huge part of that. Yep. Because security dies in secret, is kind of the thing. So getting that information out there has been huge. And the 405B group and, the healthcare industry, the public sector group, they've got a website, Health Sector Council, that has a lot of great information on it, a lot of great consumable stuff, links out to resources that we tend to keep an eye on a lot ourselves and we find really valuable.
No, that's good. Just going back to the whole education awareness piece, I mean, that is absolutely critical. On the provider side, as I was talking about, and you were indicating, if you go onto the Health and Human Services website, there's about 5 different publications that went out, and this was all released back last December, and in fact they're just going December of 2018. And any of you that are providers out there, you would certainly do well to take a look at these documents. But what's also nice is that although it was developed primarily focused on the provider side, other stakeholders within healthcare can certainly leverage a lot of the best practices that are part of this. But HHS has gone on in the 405D and has been spending a significant amount of time on education and awareness and making people aware and stakeholders aware that these publications are out there. So as Jeff was talking about, as well as the healthcare sector, there's a lot of great resources out there that all of you should take advantage of and use that can certainly help within your own infrastructures as well. So please do so. And after you go through this, if in fact you need any of those links, you can either contact either Jeff or myself. We'd be happy to get you those links.
So Lee has teed up some really provocative topics, and I think that security is one of the central features that we're going to be talking about when we talk about TEFCA, right? Anything that increases the shareability of such sensitive information as electronic health information, security is always going to be really the central question beyond simplicity of exchange. And so we really want to talk about what it is that TEFCA is going to provide in terms of improving your operational and organizational security. I think one of the key factors here to remember is that every healthcare provider, as part of the exchange and as part of their own operations, is obviously required to be subject to the HIPAA rules, the high-tech regulations around security and all of the qualifying rules. So every one of these QHINs is going to be sure that everybody who's participating in their network is compliant with all of these rules. And let's talk about what that really means in terms of participating. So as we all know, with respect to HIPAA, the regulations around protecting electronic health information, and TEFCA takes a slightly broader view of EPHI, or electronic health information, rather than just EPHI, that HIPAA does, but they're largely very similar and very commonsensical in that health information is very, very sensitive. It's very important to the continuity of care that you're able to get this full and detailed and sensitive information shared around. And obviously, if that were to leak out, the implications from a patient perspective, from a privacy perspective, would be pretty drastic. So the first thing that's involved in this is that everybody understands that where the exchange of this information comes into play, consent's obviously very necessary, and it's very important that everybody understands that the laws regarding consent are different regionally and state to state. So this is going to be one of the challenges that TEFCA hopefully can help to resolve, is navigating that sometimes rocky waters of intra-regional exchange. One of the things that we want to make sure of is that all the documentation regarding the consent is able to be exchanged via the networks and the QHINs, so that maybe that helps us get to a better ability to exchange this documentation and have the authentication that we've gotten the proper consents to exchange documents. So that's one of the areas that we feel like TEFCA really needs to provide that guidance and that simplifying implementation that makes this exchange of information so hard sometimes. QHINs also have to have processes for allowing individual participants to revoke their permission, their consent. And this is, very, very common in today's world around privacy. When you talk about things like GDPR, or in my state, the CCPA, these privacy rights that are coming up at the individual consumer, the individual patient level. A patient is really in control of their information ultimately, and they have this ability to withdraw consent. Making sure that if you are, regionally or maybe across the country, a patient is on travel, gets sick, needs some health care, being able to get the most up-to-date and accurate sense of what has been revoked, what has been permitted is going to be crucial, because getting as much open access to that data is going to be vital to providing the best care for the patient. So if we think about what we look at here, obviously QHINs have their regulations. The individual providers have to comply with the HIPAA rules. One of the things that we really want to look at in addition is taking a look at how all of these different model privacy notices can kind of get put together, and that's where we look at what it is that TEFCA is going to provide for us here. So that model privacy notice is very helpful. In addition, what we want to look at is, in addition to the high trust and HIPAA regulations, TEFCA does require conformance with the NIST standards around security. And then when we talk about assessments a little bit, we'll talk about how that gets implemented from a practical perspective. But what we're done is adopting a number of these major security frameworks and just incorporating those so that everybody can follow them in a way that is prescriptive and helpful and designed to guarantee a minimum baseline of acceptable security for patient information to be moving around. This involves things like identity proofing, making sure that the people who are participating in the network have appropriate required usages. It involves security labeling of information to say that while you are properly identified as a provider and a certain specific provider with an appropriate use, that again, the information that you're getting in a given request is appropriate to your intended uses. And finally, one of the things that we'll talk about as we move on and talk about the specifics of certification is the kinds of things that every organization needs to be thinking about in terms of getting ready to participate with a QHIN in the exchange framework. Okay. So when we talk about this, initially certifications being issued through EHNAC related to this, there's really two levels of accreditation. There's accreditation at the QHIN level, which is what the networks are going to do. And then there's accreditation at the participant or participant member level, which is what the individual HIEs or HISPs at the participant level, or the users of those HIEs or HISPs at the participant member level would be operating in. The certification originally was released in October, and just to kind of point out how quickly this stuff is moving, it's already been revved from version 1 to version 1.1 this month, just a few days ago actually. The idea here is that we take the certification and we incorporate the HIPAA compliance guidelines, the NIST cybersecurity framework guidelines, and the High Trust Alliance cybersecurity framework guidelines. And it's kind of a superset of all of those things. And these themselves are all sets of requirements that embody the best practices to enable secure and flexible organizational security from an operational as well as a technological perspective. So the most recent revision, I believe it was, also incorporated elements that kind of affirm compliance with GDPR. And when we talk about the QHIN certification, this is what, as I said, the QHINs will use to certify as compliant with the TEFCA regulations so that they can participate in the network. There are some additional requirements, but this is the certification of their ability to meet those. And part of the QHIN certification is making sure that these QHINs understand the expectations around them from both a operational security as well as a performance perspective, so that they're aware of what is going to be involved in being one of this network of networks in the trusted exchange. From a participant level, it's much more about those participants, and as I said, the INs, the health systems, the payers, the patients, and this is process as well as security. It's resource management as well as process, and obviously participating, being a member of a QHIN, or participant, I guess is the technical term, requires that you're complying with all of the agreements and regulations of that particular QHIN, and there's that common agreement that's going to govern that. So one of the things that I wanted to talk about a little bit was, or maybe kind of throw over to Lee, was some of my thoughts around how do we get in here and really think about how does the TNAP certification process help the providers to ensure that they're providing an appropriate amount of governance and generating that trust that certification is intended to solve for?
So it's a great question, and I thought it was a great overview. So I do think that whether or not it's going to be the hospitals themselves, providers, this TNAP initiative and program is really going to be whether or not you're a provider, whether or not you're a consumer, a patient. The intent is to increase the overall level of what I would call stakeholder trust throughout the entire network and this exchange. So if you look at here's an example. So if an individual, Lee Barrett, who travels a lot, goes from Connecticut to California, gets wheeled into the emergency room in California and is unconscious, the attending physician is able to take his wallet out, find a license or some other identification. He's able to then key that information into their electronic health record system, whatever it is. And then what that's going to do is it's going to pull all of these various QHINs to be able to gain access to and to develop my EHR record in that emergency room, so that that attending physician can then automatically start to create a treatment plan for Lee Barrett while he's there. That level of trust and exchange, Jeff, kind of going back to your point, one is I have already verified between all of these various entities. They've already gone through the common agreement, so they've already been, quote, authenticated that way. Second is the level of privacy and security throughout all these various exchanges will have been demonstrated and reviewed as part of the TNAP accreditation program. So the organizations need to have demonstrated that. So that on various, numerous fronts, the level of privacy, security, as well as being able to have specific aspects of the review that the providers are going to know, or even the consumer who's actually, again, going onto a provider portal to gain access to their information, is going to have a much higher sense of trust in the exchange that's going on between all these various networks to gain access to, whether it's an inquiry or to push information to the portal or to a QHIN, to be able to demonstrate and to know very well that the level of control has really been in place here and been reviewed, and there's been a level of oversight to assure that that's in place. So that's going to be absolutely, I think, critical, because the minute there's a breach in this exchange digital highway, people are going to lose confidence. So we have to continue to work at assuring the level of confidence throughout all the various stakeholders that are going to be utilizing the network and gaining access to that information.
I think you made a key point there, Lee, which was this is externally certified and audited, so this is not self-certification. You have this comfort that a third party has very rigorously looked at the requirements and affirmed that this organization has met them. And if you're wondering how do I know what these requirements are? I will throw a plug Lee's way a little bit and say that the EHNAC organization, EHNAC.org, you go on their site, you go to the criteria section, and you can download the actual requirements for either the TNAP QHIN or the TNAP participant certification. And it's quite robust and evolving, I would say, but it's a great indication of what you're going to need to do and what your evaluation process is going to look like. And I highly advise everyone to check that out sooner than later so that they can start planning for their implementation.
I think the only other thing I would add to that, Jeff, is the fact that it thanks for letting everybody know. And also, if you want to download it to take a look, it's all free to be able to do so. So it'll provide you with a good idea if you're looking to be a QHIN or if you're looking at from a provider perspective or viewpoint to be able to see what's included. So it's all free to be able to download it and see what's included. So it is a good way to better understand the level of controls and oversight that's going to be part of that.
Sounds great. So I want to be sensitive to our time, kind of keeping an eye on the clock, and mention that as we go forward, I'm going to work on being a little crisper with my language so that we don't keep people too far over time. But the next topic that we wanted to talk about was this notion of exploring best practices around IDV, identity verification, authentication, privacy, security. So when we talk about identity verification, the key point to make here is that the TEFCA requirements are a minimum of what's called IAL2 or Identity Assurance Level 2 from the NIST. And this has been an evolution of what was previously called the level of authority or level of authentication, rather. And what they've done is they've split it out so that you can identify a person and verify who they are, separate from being able to authenticate that that person is the one logging in. So from the identity verification perspective, it requires that you have multiple sources of information identifying this person. They require in-person or automated. And from a real quick perspective, just mention that you can automate IAL2 level identity proofing from a number of sources, some examples being ID.me, Experian, Athena offers it, and the U.S. Post Office for that matter, and many, many others. So just understand that from an ID verification perspective, the whole point here is that you have a very strong sense of certainty that when I say that I am Lee Barrett or I say that I am Dr. Jones on this thing, that account that says it's Dr. Jones is in fact Dr. Jones. And it's because the ID proofing has been done there and that people who are on here have a legitimate business purpose to be on here. From the authentication perspective, this is where they've split this up, and now the spec here requires that you're using Authentication Assurance Level 2, AAL2, or better when using or requesting EHI, Electronic Health Information, through the TEFCA. The idea here is that the key takeaway is AAL2 requires multi-factor authentication, which is more than one piece of information, both a password and some other thing in order to gain access to the system to be authenticated. And a couple key points here are at the levels of MFA in AAL2, they no longer accept text verification. So sometimes when you log into the website and they say, we're going to text a number to this phone number that you have on record, tell us what that number is, that's no longer acceptable because it is subject to potential interception or man-in-the-middle. Email, for the same reasons, is unacceptable. And what they call knowledge authenticators, or sometimes they're called out-of-wallet questions, which is like, hey, which of these streets did you live in your past? That kind of stuff is also no longer acceptable as an appropriate MFA channel under AAL2. So it requires a higher level of security. So what can you use for that second factor? These devices that deliver one-time passwords. So if you've ever had, maybe for a bank or something, that ticking number that keeps changing every 30 seconds, and it's going to ask you what's the number right now, and you have to enter it in, or software like Google Authenticator or Authy or OneLogin that will produce that multi-factor, that second factor. Or the third option that is also approved is what's called MFA cryptographic hardware, which is things like YubiKey or Google Titan, and you can Google those to see what they are, but they're little USB keys that you plug into a device, and it automatically provides that second level of authentication for you. And the idea being, even if somebody gets your password, they're not going to be able to impersonate you because they don't also have your key. So in order to get in, they'd have to both steal your key and steal your password, which are very independent things, and it's just that much harder to do. In addition, one of the other key requirements in TEFCA is that from a security and authentication perspective, there's number one, a formal policy around auditing of events, and that those auditable events are being securely logged throughout the entire system, so that every access on these so-called auditable events is properly logged by the system and being able to be tracked appropriately, so that if any time you need to go back and see what did this person do, you can see all of the auditable events that actually took place there.
So Jeff's done a great job in talking about the whole identity verification, authentication. There's a lot of issues that are taking place and are incorporated under TEFCA. One of the other aspects here is the whole use of blockchain, and many of you have heard about blockchain, and it's certainly widely used. But a lot of people are saying, "Well, gee, what is it? What is blockchain?" I hear different things about what it is, what it isn't, and is it kind of the latest and greatest technology, and is it going to be around for a while? So let me first, before I go into kind of how it works, talk to you a little bit about what is blockchain. Let's try and define it. So it's really a decentralized digital ledger that really keeps permanent, unalterable record of transactions between users. It's one of the greatest benefits that, of the technology is that it's significantly more secure than other data storage platforms. And a key characteristic which is making it especially appealing is to store and share personal health information, or PHI. So you can see some of the applicability there. And because of this, really blockchain is beginning to showcase itself as a potentially game-changing technology, as we're seeing in healthcare. So if you look at some of the background here, it's really, again, decentralized network, really across different geographies. It can really help to alleviate the challenge of interoperability by allowing sharing of data access across institutions to whoever is granted the access. So as you're looking at it, I mean, the issue of interoperability, which is a key component of TEFCA in 21st century, this becomes an enablement, an emerging technology enabling interoperability. So, and it really fosters really instantaneous exchange of information, whether it's money, contracts, really according to pre-established smart contracts and without a middleman. It improves data security as well because it has no centralized point of failure, and all users are held accountable for the edits, the exchanges of the data, and the data cannot be accessed without a highly specific digital access key. So, the issue here is it's really providing that level of security that we're looking at, and from a timeliness perspective, very, very fast. So I'm going to give you an example after I go through how blockchain works here, but we're also seeing that it really can enable patient control of PHI, which grants each patient a personal digital key that they would be free to share with their providers. And again, they have where the actual patients now have that control as far as which providers have access to their patient record. So if you look at kind of how it works, you can see here it goes through an entire process of validation. You can have cryptocurrency as well. So and really it's being added on as far as the various blocks that are part of the entire data exchange as far as how a blockchain is sent and exchanged between the various participants. If going to kind of this blockchain, there are really two different types. One is a private, one is a public blockchain network. You can see one is permissible. Basically, you have to have permissions on the right-hand side between all the various entities, and the other one is non-permissible, where information can be exchanged and go between the various entities without permissions. So these are the types. If you look at blockchain in healthcare, here's a quick example. How blockchain can be used, and we're starting to see it in many different situations. But patient who is going through, has been determined, diagnosed with cancer, needs to go through a whole cancer treatment regimen and process and program as part of their entire treatment and coordination plan. To do that requires a number of different doctors and various organizations to have to sign off on and approve a particular patient plan. To do that and to go through all these various entities that need to, quote, approve the patient plan can take a very long time through normal process to gain all those signatures. Using blockchain, again, looking at it from a digital ledger, I can go through a number of different providers who can actually go on, and various caregivers who can go on to this particular caregiving treatment plan for patient A, and it could be approved digitally and through the blockchain very quickly in a matter of probably a day or even less, depending upon, again, it's up to when the care provider is able to just sign on and to actually approve. But it's very quick, and so an entire treatment plan can take place and be approved much more effectively, much more quickly, so that a patient can start a treatment plan much faster than they can through a normal cycle of having to get all of these various entities to sign off. There's an example of how blockchain can be used in healthcare. Now, the one other thing that people ask me all the time about blockchain is, hey, sounds great, sounds like there's some really good aspects and use cases for blockchain. Is blockchain the end-all? The answer is probably not. Blockchain is a great emerging technology today. Blockchain is also included in the Trusted Network Accreditation Program as part of a review if an organization is using blockchain, so it would be part of the accreditation review that an organization would go through. But blockchain, just like a lot of emerging technologies, is going to continue to evolve. We think that it's got some great applicability. There are some great use cases for blockchain. Will blockchain be the entity and the technology 5-10 years from now? It'll probably evolve into, and there'll probably be other new technologies that will emerge that will probably incorporate aspects of blockchain, but it's going to continue to evolve for sure. But it's got some great applicability today. We're seeing some great benefits from it. So as you're looking at blockchain and you hear of different organizations and different use cases out there, I would tell you, absolutely take the time to understand it. Take the time to understand how it could be applicable perhaps within your own environment and what you can do to take advantage of the capabilities and the really kind of not only the savings in time, but certainly savings in money that can occur by the implementation of blockchain. So that's just hopefully provides you with an overview there. Jeff, based upon kind of, as we've kind of gone through TEFCA and an overview here, of certainly as emerging technology, blockchain, are you seeing, how are you seeing it implemented out there? You have any other examples that you're seeing, A, and B, are you at all hearing much about any of the risks about leveraging blockchain in healthcare, and in that case, any suggestions on how they could be minimized?
Sure. So I think the use case that you gave most recently, the sign-off on the treatment plan, that to me is the essence of where blockchain shines, right? This is a relatively small piece of information that you want to have distributed broadly, but have this globally trusted proof of authenticity, right? That's kind of where blockchain is perfect, because no one source holds the copy and is subject to potentially having it being manipulated because this copy is distributed. They're all checked against each other, and anybody who doesn't conform in the block is kind of ejected from it. So you can just tell that if there's a manipulation, it has no chance to get back into the chain and then update the content of something unless all, or actually it's a quorum of the participants in that network agree that that's a valid copy. So it has a great benefit for verifying authenticity and keeping changes from happening either inadvertently or maliciously. One of the challenges with blockchain is that in its current evolutions, one of the features that makes blockchain really interesting for cryptocurrencies is also a challenge in health records, and that is that the more information you put into the blockchain, basically the more blocks you have, every block is slightly more computationally costly than the block before it. So the computational cost of adding to the chain gets higher and higher as you go. And so the more information you put on there, the harder or more expensive it gets to add the next piece. And so when we talk about healthcare, which has enormous volumes of data, you want to make sure that you're doing things as many solutions now are, these hybrid approaches, which is to say, I'm not storing the entire health record in there, I'm checksumming it, digital fingerprinting the record at a point in time, and I'm putting that fingerprint into the blockchain, and that guarantees that I know that this fingerprinted version is authentic and validated within the block, but I'm not having to burn so many blocks storing your health record. So that this notion that you have a distributed exchange of the health information, which is obviously what TEFCA is, and then a blockchain can be used to validate that any given version of that data is the appropriate and current version. I think that's a great use case, and that hybrid approach where you're not putting the entire content into the block, but just putting in a fingerprint of that content, it gets both of those benefits, which is that guarantee of authenticity, but also mitigates that risk of just getting so computationally expensive that nobody can afford to put something new into the chain.
I think one of the other aspects, just quickly as well, is the fact that, as we talked about from blockchain, patients now are going to have greater control over who they're going to give access to as far as their providers. So one of the issues as well is going to be that for doctors who want to gain access to a patient's PHI, for example, from the standpoint of how they're going to diagnose and treat, again, there could be some implications if a patient has not provided that physician with an access to their records through the blockchain as well. So another aspect on who's going to have access to and who's going to provide that level of autonomy. Certainly from a patient perspective, we want to have that level of control, but if a doctor needs to gain access to that, it could be a limiting factor. So another aspect that people at least need to be aware of as far as blockchain and its implementation.
So we've taken a chance to take a look at some of the specific topics and areas that are going to impact you as you look to TEFCA and TEFCA implementation. But we wanted to kind of finalize this with a little bit of a look back at really understanding the underlying purpose of TEFCA and how it can, or 21st century cures, and how we can take that and bring it into fruition, which is the two really primary goals here, right? Improve healthcare and opportunity to lower healthcare costs. So we'll talk about that a little bit and then kind of give our final thoughts on that. From a perspective of how we can provide better care, it's fairly evident, right? I mean, there's from a provider level, just being able to have access to the data, right? The more information you have about the patient in your care, the better care you can give. There's a lot of information there that's useful. One of the other interesting opportunities that TEFCA hopefully can afford is access for new and innovative either applications of healthcare data or technologies that are difficult to come by now, because if you don't have access to the underlying data, you can't do interesting things with it. And being a technologist, I sometimes jump on a soapbox and say, startups are able to do such amazing things, but a lot of times in healthcare, they're hampered by an inability to get a hold of the actual data to do interesting things with it. But even more so from a consumer perspective, that healthcare information, your healthcare information, being able to follow you so that they're always, accessible whenever you need them. And, let's face it, most times healthcare needs are a little bit of a surprise, and when you need them, you really need them. So having those things always be available, no matter where you are, no matter what happens, is going to be vital, I think, to improving the quality of care for patients. And finally, if you just think about not having a certain piece of information at a key point in time, unnecessary tests being run perhaps, treatment being applied that is inappropriate given some piece of information that might be living in a file folder in your endocrinologist's office or something like that. The whole idea here is that this is all out there and that complete picture can guide better treatment. From a cost perspective, there's a couple specific areas, right? The sharing of information, again, can avoid things like needlessly repeating a test because you need the results in order to deal with the patient in front of you now, but that test has been done 2 weeks ago, you just don't have the record for you, and just lightening the burden and getting transfer of health records around from provider to provider to provide that continuity of care. The other interesting aspect of TEFCA is to try to allow for this population-level queries, which lets you pull kind of trended population-level data and to allow, perhaps the ONC or other entities to analyze the cost of care in regions, to analyze the propriety of care in regions, the best practices of care applications and outcomes. This kind of population-level data expresses some really interesting opportunities. But I think we'd be remiss to say, TEFCA is just going to lower costs. We have to be thoughtful of the fact that getting to implement TEFCA has some possible infrastructure costs, for these new centralized exchanges that need to be really, thoughtfully considered and creatively addressed. And just getting up to speed, new compliance costs, certification costs, staffing maybe to meet needs. There are some costs that have to be thought of as well, not just cost savings, and we need to be mindful about trying to keep the barriers to adoption of TEFCA from getting in the way, because I think the vision here is compelling and it's inspirational, and I think there's nobody who would disagree with it, but these barriers might really hamper adoption, and we really need to make a conscious effort. And I know that one of the things that the RCE is really thinking about is how to keep the barriers to entry to this as non-existent as possible, leverage what's been done already, and encourage participation, because this is one of those network effects where the more participants there are, the more valuable it gets for everyone. And Lee, I wanted to throw it over to you and kind of get your closing thoughts on kind of the ultimate goals that TEFCA is designed to address.
I think, Jeff, good summary. I do think that really it goes back to the example that I gave. This on really if the individual who, such as myself, that is going to California, gets wheeled into that emergency room, and being able to gain access to my information as quickly as possible, whoever that patient is. That's going to drive down significantly mortality. It's going to increase, I think this is going to increase as well, the availability of data certainly to patients. Patients are going to have a lot more control, as we've talked about, in relation to who's going to have access to what, and they again have the opportunity to do that. But I think it's going to, if you leverage all the various, the QHINs, these health information networks, HIEs, accountable care organizations, all the various entities that really have been aggregators at various exchange points, this starts to put all of that together into a way in which, one, we've got some rules of the road, and we have some guardrails on how information exchange is going to take place between all these various entities. That's one. Two, it provides for information much more quickly, much more effectively, cost-effectively as well. But from the standpoint, from the standpoint of privacy and security, we have oversight on privacy and security on how this actually is going to occur. And the other aspect is in addressing the issue of interoperability, we start to break down the barriers around proprietary interfaces and some of the obstacles that have occurred in the industry on really, I would say, creating barriers on being able to exchange data. If we can create more interoperability, we have less issues on any of that between various systems and environments. So now that data exchange and that flow can occur, then I just think it's really we're going to be able to accomplish a lot of the goals, the objectives that we want to for healthcare and for patients and all the various providers and the various stakeholders that are really going to see the benefit from this environment.
Well, I appreciate kind of having an opportunity to have Lee as my personal private sounding board here, but I think it's time for us to throw this open to everybody who's been listening out there in Webland. So we'll throw it back to Carol and talk about questions for us.
Great, thanks so much. That was a great presentation with both Lee and Jeff, and we naturally have got some questions that have come in. So we're going to spend a little time sort of extending this webinar to get as many as we can answered. So the first question is the Sequoia project. Can you talk a little bit about why the Sequoia project was selected to be the RCE?
So this is Lee. So what I would tell you is that the process that the Office of the National Coordinator went through to solicit organizations to submit and to nominate themselves for the selection process, they had actually gone out as part of the second, I believe it was the second version of TEFCA, which was released in last April, and then I believe they gave organizations starting from from the June timeline to actually submit any recommendations or nominations. So the timeline that ONC had specifically stated as far as their roadmap said that they were going to make an announcement by the August-September timeframe. So it was open to any organization. They did have, I'm sure ONC had specific requirements, and I think that one of which was they were looking for organizations that, one, were nonprofit, two, that were consensus-based, and then three, I think they were looking for, again, organizations that were really soliciting input and were really very connected with the entire industry as far as health information technology. So I think those were kind of three overarching aspects of the review process, Carol, that ONC was going through. And in essence as well, from what we know, the Sequoia was the only entity that actually submitted to their nomination to ONC for consideration. So it wasn't as if there were other organizations, at least from what we know. They were the only entity that submitted, and again, they also met the criteria that ONC was looking for, and I believe they've already had at least one meeting with ONC, if not more, and they've also gone out to the industry with at least probably a couple of webinars already to outline their timeline and roadmap as they're looking to solicit input and to have a very open, transparent process as they look to develop the common agreement with the industry.
And Jeff is having some audio issues, so I'm going to move on to question 2 while he's logging back on. The QTF is in draft 1. Is TNAP accreditation for QHINs just based on that draft? Is anyone doing that accreditation today? Or are the HINs waiting for the final QTF to know what's technically required to become a QHIN?
So the TNAP accreditation, it's a great question. So the TNAP accreditation was going through, and we had a number of organizations, as I had mentioned, over the summer of 2019. There were 6 that were beta organizations and went through that accreditation process. We took all that input that they have provided, as well as the 60-day public comment process that we used during that time, and integrated that into the first version 1.0, that we released to the public in early October. So we have a number of these organizations are early adopters. We have other organizations that are looking to be early adopters to go through this accreditation program. What I can tell people is that the accreditation program is going to continue to evolve. It is built around the information in TEFCA, the version 2 draft that was out, as well as the QHIN technical framework version 1. That's what we had. That's what it's built upon, and we've continued to integrate all of that. But this is going to evolve. We're going to get additional guidance, not only from the RCE, from Sequoia, but also from ONC in 2020. As we get additional guidance, as we get additional, perhaps even other aspects or best practices that we need and should incorporate, we will continue to evolve the program. We will continue to go out with a public comment process to gain additional feedback from the industry as we continue as the process is TEFCA and really this entire implementation starts to evolve, Carol. So it is by far not complete, but certainly we've got everything in that we have been aware of. And the difference is that the TNAP program is not, quote, just totally based upon TEFCA. We're trying to, again, align with TEFCA and 21st Century Cures, so the program is not dependent upon them, but we will continue to evolve the accreditation program as we get additional guidance from the industry.
Next question, and I'm kind of a blockchain nerd, so can blockchain be utilized to resolve the conundrum posed by different state law patient consent requirements? On that question.
So I think it's absolutely, blockchain is certainly being used not only nationally but internationally. In answer to, I think the question, I think there was a question, the concern maybe be around patient consent. Is it going to address some of the various state patient consent laws and regulations that vary? It certainly, the patient consent aspect is there, and patients, many states have this in place so that patients have control over their records, and that people aren't necessarily, they're not giving patients the right to have control over their record and what information they want and are willing to be shared. So certainly blockchain is going to be an enablement technology. When patients have gone in and made the determination on what they are willing to do as far as consent for their information to be exchanged and with whom. And once that's determined, certainly as far as being able to expedite, whether it's treatment or other means in which blockchain can certainly be utilized to create a far more effective process for approvals, et cetera, then I would tell you that blockchain is going to be a great technology to do that. But the intent is not to eliminate the consent aspect that states have put in, but again, to give patients, you want patients to take the responsibility to have on their record and determine who they want to consent with, but once they make that determination, Carol, then certainly blockchain is going to be a great tool to speed process, either, as I said, either with treatment or the various other types of implementations that blockchain could be used for.
And I think, Lee, that's the key point. Blockchain is just a technology. It is not a goal in and of itself. It's not an end in and of itself. And the uses to which it's put really do have to be informed by all of the other requirements around disclosure, around consent, around individual, state and regional privacy regulations. So it's a tool. Don't think of it as more or less than that, but it's a really interesting tool for some really hard problems to solve around, kind of distributed data and verified authenticity.
Great clarification, Jeff. Thanks.
If an organization goes through a TMAP participant accreditation, will they also need an evaluation and or certification from the CLIN in which they are participating under?
So here's our current thinking. So this is obviously, as we've talked, a lot of this is going to evolve in 2020, in which we're going to get some better clarification around how QHINs are going to operate, the common agreement itself, and what's going to be involved in the common agreement. The hope could be, as a scenario, if an organization, let's say, so under the TNAP accreditation, there's actually two types of accreditation. There's one for QHINs, one for participants. If perhaps if this evolves, if the common agreement, and I'm underlining the word if, because all this has to go through a process, and we'll see what the common agreement ends up being. But if, as a scenario, the QHINs went through the TNAP accreditation, and that was also then determined that as well, if a participant goes through the TNAP accreditation and has gone through that successfully and has gotten that accreditation, the hope is that the QHIN would accept the participant's accreditation, therefore not requiring anything further, since they would have met, hopefully, that requirement as part of the common agreement. So that's hopefully a scenario that we're hoping can play out here, Carol, so that it will. In that case, we're going to reduce a lot of effort, a lot of time that organizations need to go through if they're accepting the accreditation as really a requirement as part of the common agreement. We'll have to see how that evolves, but that's hopefully what we're looking to have occur as part of the common agreement, and set that out as a specific requirement as well.
All right. So how does TEFCA apply to clearinghouses? I don't know if that's a question we can get into on this conversation or not, but somebody just posed it, so I went ahead and asked it.
Jeff, do you want to start that one, or do you want me to?
So let's say that how it relates to exchanges is fairly clear, and to the extent that clearinghouses are participating in that same model, it seems pretty obvious. But I don't think I've got a lot more to contribute other than that. What I've talked to in a lot of HIEs is, to that point of, are they ready to get into it or not? And the answer is they're still keeping an eye on this, and everybody's eyeing up this accreditation process. But I don't have a lot of insight into clearinghouses per se.
So I would just add is that certainly as you look at all the various stakeholders, whether the QHINs, and you look at participants, and I see the clearinghouses playing a very significant role as part of a lot of the exchange. They're going to be another input and data exchange point for input into and working with the QHINs, working with participants. So a lot of the aspects that we're talking about here on privacy and security of all the data exchange, the aspects of how all this data is going to occur. Clearly, I see the clearinghouses continuing to play a very significant role. If you go back to the point of where I've talked about the being rolled into an emergency room unconscious, and all this information needing to be gotten on that patient to assemble an EHR for that treating physician as quickly as possible in seconds. The clearinghouses, along with the QHINs and all the various stakeholders here, are going to be very key in being able to accommodate and to allow for that data exchange occur and for that record to be created very quickly in seconds. So everybody's going to play, I see, a very significant role here as part of this whole data exchange. I think we're, again, waiting on some of the, quote, rules of the road that will come out of this from the standpoint of the RCE as they develop the common agreement, and from ONC as well in 2020. But whether it's, hopefully the TNAP accreditation starts to set out some parameters as well for organizations to look at. But, going back to the clearinghouse question, we see them as, again, another significant stakeholder as TEFCA rolls out and becomes implemented as far as the digital highway.
Well, believe it or not, our time has ended here. Thank you so much, Lee, Jeff, for a great presentation. A copy of the recording of this event will be sent out to all of our attendees and participants. So again, thank you again, and we will see you on another thought leadership event with J2 Global and TEFCA Corporate in 2020. Again, thank everyone for their time today.